Scarlet fever most commonly affects children between the ages of 2 and 8. Between September 2015 and May 2016, out of the total 12,906 notifications of the infection, 89% of these were in children under 10. The black line in this graph shows the scale of the increase between 2015 and 2016, compared to the previous 4-year average, represented by the grey line. Scarlet fever notifications in Cheshire and Merseyside here in the northwest were the second highest in the country, with 32.5 per 100,000 people, more than double the lowest of 14.7 in London. Dr. Teresa Lamani, head of streptococcal infection surveillance for Public Health England, explained that the PHE's analysis of the data has found that every 4 years or so there is a higher than average year for scarlet fever. However, this natural cycle does not explain the current outbreak. As researchers continue to ponder over the rising cases, it's worth looking at other potential causes, and one is perhaps that the awareness around the disease isn't as prevalent as it once was.
I'm sure there has been a rise in cases, I'm sure that is genuine, but I think part of that is due to the fact that people are now more, doctors are more aware of it, and possibly parents are more likely to bring the children.
Do you know what scarlet fever is?
No idea.
It's a disease that was vaccinated against. I don't know the exact pathophysiology of it.
Yeah, I do know that. I came to know from the nursery. My son, there was a breakout here, and it's something which is coming back after ages.
Given there is no vaccine for the fever, it will continue to affect children of all ages. In schools, however, it is important that they continue to take steps to prevent infections before an outbreak happens.
Well, we actually use the guideline, the guidance on infection control in schools and other childcare settings, which lists a variety of symptoms and problems, and that tells you exactly what to do. For example, we do 48 hours for vomiting and diarrhoea, where if a parent reports that the child has been sick at home or if they've been sick in school, then we ask that they're kept off for 48 hours. And that's a generic, probably across all schools will do the same thing, but everybody follows those guidelines. So if, for example, a parent says the child has got chickenpox, then we would simply refer to that guidance, and that is exactly what we would do. So ideally that's probably should be consistent across all schools. In any public building, you will have a set of procedures that your caretaking staff will undertake to make sure that things are cleaned regularly and appropriately, and then you will have monitoring from the local authority from the environmental health team, monitoring of your kitchens, and they will come out and visit, and they will give you a hygiene rating and give recommendations for any improvements which can be made there. And then also you can have some input from the school nursing team, who will come out and do hand washing and personal hygiene workshops with the children. So for example, they'll bring along I think it's ultraviolet light things where they get them to wash their hands and show up the bacteria and things. And they're regular activities that schools will do, generally once every 12 months.